staying with us. Now, for the next panel, we're going to be looking, as Pam said, at operationalizing, implementing, and institutionalizing One Health. Once again, please, put your questions in the Q&A box, not in the chat box, and we will try to segregate these questions based on the panel and the specific questions that ask the panelists and what your questions are in that regard. Same rules: 5 minutes from a commissioner, 5 minutes from an expert, and in the very first set of panelists, we're going to be having Carlos das Neves, who is the chief scientist at EFSA and the co-chair of the One Health High-Level Expert Panel, OLEP. We're really honored to have you. It's been a pleasure working with you, Carlos, a really excellent scientist. And we have Serge, who's with the FAO. He's the Pandemic Fund Program Coordinator at the FAO and the former One Health Coordinator for Africa. And we have Ole Petter Ottersen, who is a physician, a global health leader, very well known. He chaired the Lancet Commission on Global Governance for Health and is currently the vice president of the Virtual Foundation. He is going to be leading the version 2.0 edition of the Global Governance Lancet Commission. And so my first question to you three gentlemen, starting with Carlos, is how does sustainable food security inform One Health governance, especially given all that we've heard about the role of food systems in One Health? Over to you, Carlos.
Thank you very much, John, and a very good afternoon to all those tuning in today for the report. Extremely happy that we're finally able to share it with all of you. And John, perhaps to answer that question, I would like us just perhaps to tune us all into this. What does this mean, sustainable food security? And perhaps that pitch or that advocacy has now been made easier because, as you heard all my colleagues here and there, food has really been brought to the table already here. And I guess this shows and highlights very much, and forgive me for the biased opinion, that food really is the perfect playgrounds for One Health. It is really a point of interconnectedness among many of the topics we have heard. Because in foods, we know that the burden of infectious diseases is seen. We know that unhealthy food consumption patterns lead to some of the non-communicable diseases that we have heard. If you have been ignoring plant health in One Health, food is the place that tell you you cannot do that. And we know that food is being affected by the changes in climate, leading to major shifts in the capacity to produce. But we cannot close our eyes, and the report also highlights this, that the way we produce food is also leading to this climate change crisis. So it's an interconnectedness point, but it's also an interconnected crisis around these foods. And what makes perhaps this topic even more engaging and perhaps passionate is that food is also that. Food is also passion, it's history, it's culture, it's tradition, it's economy. So when we say sustainable and we say security, we need to understand that sustainability includes, first of all, to recognize this interconnectedness. We need to accept that the sustainability of our future systems cannot be run in business as usual. Because whether we're talking of environmental degradation, of wastes, of shifts, but also of the positive ones, of innovation, and I know Serge is coming after. Just a few months ago, FAO released another publication on 44 future trends for the innovation of foods. These are unique possibilities to ensure the sustainability, but they need to be done with another lens. And this is the One Health lens that we are proposing in this report, should be employed to make this transformation. And also be aware that when we speak of security, we are putting a lot into that terminology. Security is also safety. Security is more and more also sovereignty. And these are aspects which are extremely important across the planet. And I speak, of course, from Europe, and even in what is one of the most richest continents of the planet, we are observing that up to 9% of our population is not able to put a healthy diet on the table every second day. And we are experiencing just in the continents the challenges of food shortages, food crises, whether they're driven by war or natural causes. So this one lens is needed. I won't touch the funding, but when you look also in the way we drive food production, it's easy to say that governance and the systems in place need to evolve. And as you navigate through our reports, especially in the recommendations, of course, you have the recommendation number 2 on governance that Andre already highlighted today. But on recommendation 4, 6, and 10, I think these 3, and the last one is actually entirely devoted to food systems, you will find some of the ideas that we put on the table, and I will quickly just try to give you a snapshot of what they bring to the table. They bring to the table that governance needs to be a real systemic transformation. I'm sure my colleagues will speak more about governance as well. And this global governance by systemic transformation, I would highlight 2 aspects. It needs really to internalize that we need to be inclusive. Governance is not only to be about politicians legislating or the big economical interests of food retailers, for example, or big companies. It is the inclusion of the small landowners, the traditional food production systems, and last but not least, of the consumers. Consumers that very often have been uninformed, and that in this dangerous, quick-moving world we live in are now being moved from uninformed to misinformed. And misinformation is also a challenge to good governance. So this is an aspect that we need to embody into a new way of governing the way we produce foods. And then I mentioned also, of course, that as we bring the private sector, we have a long pathway to go, and the report will also highlight this in accountability, in measures, whether they are incentives, positive and negative, or other tools to create a new way of calling accountability along this chain. A chain which I mentioned is very broad and needs to have everyone on board. The second and final element I would like to bring on this need of governance is also to resource to the many good examples we have in place. I think Andrea mentioned there is a good description of food systems in the report, but I would also highlight here that we have, especially at international level, organizations devoted to this sustainable transformation of our food systems. My colleague of FAO will follow today here, but I could quickly think of the IFAD, of the World Food Programme, of many others. And here it's a moment to reflect. Are they able? Have we empowered them? Do they have the tools and the mechanisms to drive, to lead, to educate us all in this transformation? A question which I'm not sure we are able to completely answer in the report, but which I think we brought to the table, hoping that you can help us answer. So John, to conclude, food sustainability needs One Health, because food sustainability is indeed a complex, multidisciplinary topic, and One Health brings that interlinked vision, but also in governance especially, perhaps a new approach on how to transform all business into innovative, creative, inclusive, equitable, and most important, transformative change. Because at the end, food is also passion. Thank you very much.
Well, thank you so much for that, Carlos. I feel like we should have recorded that even as a podcast on its own and have it on replay. Thank you so much. But Serge, let me come to you and your reactions to Carlos's submissions on how does sustainable food security inform One Health governance?
Thank you, Jaron. First and foremost, congratulations to all of you. I had, let's say, the privilege to be one of the co-reviewer of the, of the report. And for me, this is a state of art, product. So having said that, and build on what Carlos has just said, when we are thinking or looking in terms of governance, I would like to emphasize on the fact that the socio-ecological approach, is calling for an institutional or structural adjustment. So if you understand that, then the link between the sustainable, food security and One Health governance now will be addressed on what are those tools what are those instruments? Carlos mentioned about the existing, let's say, organization, IFAD, World Food Program, all those instruments, the existing one. The fact of the matter is there's need to those existing instruments need, let's say, to be transformed, to address those, the food security, given that when you've factored the fact that, and one person mentioned it, that the impact is at community level. So decision maker, policy maker would like to kind of relay on tangible evidences, to inform their decision. At the end of the day, again, I will echo what Carlos said, it's about food, right? But producing that food has a negative externality. So for that reason, a few years back, we developed what we call a One Health policy tool. I will make a slight kind of a highlight here. There's a difference. We are using a policy model to look into, let's say, by increasing livestock population, human population grows, lot of parameters, how all those can trigger to some negative externality. The models provide policy options, so that can be used, in the context, of this question to help even the decision maker to inform his decision. And finally, we need to be also clear on what we call One Health governance. So by being clear, are we talking about a law which is speaking for the food security, or are we talking about an executive order, or are we talking about the, like I have already mentioned, existing instruments? The fact is, to address that challenge, those existing instruments, tools need to evolve. Thank you.
Well, thank you very much, Serge, for that. And I'll just come straight to you, Ole Petter, especially given that you chairing the version 2.0, if I put it that way, of the Global Governance Lancet Commission, and you chaired the earlier edition as well. Your thoughts on why or how sustainable food security informs One Health governance, please.
Yes, thank you very much for inviting me in, and congratulations to you and all the commissioners for this fantastic endeavor, which is very much needed in this turbulent time of ours. And I would like to refer back to Richard Horton, because yes, there are tremendous changes in the global health landscape. And I think that the One Health approach, if we rally behind the One Health approach, we will be able perhaps to serve as a sort of countermeasure to all the attempts and all the political interference that now seeks to dismantle and undermine the multilateralism that we are so much dependent on. So congratulations to the Commission. And it's a great achievement that we are witnessing today and discussing today. So Yes, I represent, of course, the Lancet Commission, also the new Lancet Commission, working on this very issue. I mean, how to come up with a better governance system for health in this turbulent landscape. And the One Health aspect is, of course, very central in our discussions, and I will come back to that. But I should say also represent the University of Oslo and the Sustainit unit there, and the One Sustainable Health Forum, which has a working group that is dedicated specifically to governance for One Health. And I'm very happy that several of the recommendations, they really focus on the governance aspect, because there is no way I can see that we will be successful in implementing the One Health aspects if we don't look with a very critical eye on the current governance system. And one of the main conclusions in the previous Lancet Commission on Global Governance for Health is that institutions are inherently sticky. They don't really change that easily with changes in the challenges around them. And I think that is a classical example here, that the institutional ability to change in response to the One Health challenges, this is one example of the stickiness of institutions that we are seeing. But I'm going to challenge you a bit. And the challenge is exactly this. How can we be sufficiently persuasive to ensure that institutions change and, change from being siloed institutions working on the animal health, plant health perspective, or the human health perspective, or the planetary health perspective, and rather look at this in a holistic manner? And I think I would challenge you by saying that there are two elements that perhaps are not sufficiently presented or documented in the Commission report. And that is that to persuade institutions really to have a One Health perspective, you need research and you need data. And these two things are coupled together. Some of the analysis we did, among other places in Africa, tell us that it's extremely difficult to come up with timelines of data from the three different domains that we are discussing here now. Timeline of data from human health, climate, as well as animal and plant health. Because in order to have a sufficiently efficient governance system on top of all this, the governance system needs to have access not only to data, but to structured data that can tell the governance system where are the most efficient entry points for One Health governance. So I must say I was shocked when I looked at some of these, and in fact did some of the analysis to really try to sort out how to deal with data and how to structure data in order to provide a platform for a better governance system, and in order to be persuasive, to tell institutions that they have to have this One Health and One Health entry point to governance. So what we are discussing, among other things, in the working group in the One Sustainable Health Forum, is that we should, at all levels, not only at the global level, but also at the regional level, the community level, the national level, try to see how can we develop One Health institutes or One Sustainable Health institutes, not necessarily a brick and mortar construct, but a community very much led by academics, because they have to get into the picture to assemble data, access data, and to structure data as a platform for better governance. This is one of the major challenges I can see at the moment. I'm very happy that the pandemic treaty tells us that things are changing, and that the governance system is responsive to the arguments from the One Health community. So it's great that One Health is integrated in the pandemic treaty, but perhaps one should go one step further, and that is to have a legally binding global framework convention for One Health that builds on the success that we have seen with the pandemic treaty, as to how to get One Health into a discussion on a better and more multilateral governance system. I think I've spent my 5 minutes, But of course, this is a very broad field, so I would be very happy to contribute further in this discussion. Thank you very much.
Thank you very much, Ole Petter, and wonderful responses from both Ole Petter and Serge. And I feel that we could have had a whole 1 hour session with the three of you addressing this question of how the relation between food systems and One Health governance. But we'll move on to a second set of panelists who are going to address the question, how can we promote sustainable One Health financing through demonstrable returns on investment? And you would recall in my submissions earlier, I made mention of the need for what we call a slow radical change in the way in which we view financing and just looking at how the world measures wealth and well-being and progress and development. But ultimately, we need to use whatever we have currently to show that there is a return on investment while we advocate for a complete change regarding the way we measure progress. And I invite, first of all, Barbara to respond to this question. Barbara is a leader in agri-health and One Health systems at the Royal Veterinary College in London. She's done extensive work, and I'm sure you've seen the chat making reference to some of the work she's done with the NEO framework and with other resources. And Ramanan is the founder of the One Health Trust and is a global expert in EMR and health access innovation and holds appointments in various institutions all over the world. And is a really true trans, multidisciplinary scientists. I'll start with you, Barbara, if you can address the question, how can we promote sustainable One Health financing through demonstrable returns on investment?
Thank you, John, for the kind introduction, and good morning, afternoon, evening, everyone, and great to see that so many of you are still here. I will summarize 4 points from our report in relation to this question. First, I would like to point out that there's a need for partnerships because of siloed funding and financing. To be able to mainstream and institutionalize One Health, and we have heard earlier from John that this is one of our key pillars, we need to secure effective financing for One Health implementation, and in particular for the type of One Health that we have been discussing today that supports healthy and sustainable socio-ecological systems. But we see that there is a historical disparity in funding and financing between human, animal, plant, and environment sectors. And often we see very fierce competition for resources, which undermines, of course, One Health collaboration and progress. The situation is even more challenging now with the recent major cuts that we have seen in aid globally. In practice, we also see that funds often flow through separate ministerial budgets, and more conventional One Health concerns are often prioritized because they often hold the promise of tangible solutions and impacts that are aligned with institutional mandates. However, there is limited funding for the softer aspects of One Health and the creation of structural foundations for long-term equitable health. Therefore, we need partnerships between One Health implementers as well as One Health resource partners with long-term change in mind and supporting a sustainability agenda. My second point is that there is an opportunity at the moment as we see an increasing number of funding and financing sources that can support countries in their One Health work. For example, there are several innovative mechanisms like development impact bonds or the Global Financing Facility and instruments for addressing debt, such as bond offerings, that can be used to leverage One Health investments. In many cases, innovative financial mechanisms involve multi-stakeholder partnerships that leverage capital from the private sector, but require the public sector to co-invest or seek co-financing from development or other partners. That's also a point that Chadia alluded to earlier, that we need to have multiple streams of financing coming together. A major actor that we see in this landscape is the World Bank, that has incorporated One Health into its development financing portfolio. It has established a pandemic fund, which is a major global financing mechanism that pools funds from multiple sources and partners. It supports countries in their pandemic preparedness using a One Health approach, and promotes cross-sectoral cooperation and co-implementation by their diverse ministries with support from implementing entities. And so it is showing how we can use such approaches and also use catalytic funding. If you would like to hear more, I'm sure our colleague Serge, who is here now, would be able to tell you more about the Pandemic Fund and how it works. My third point is that financing and funding needs to be supported by evidence on the One Health's value proposition. For many investors, having evidence on a positive return on investment is a necessary condition, but usually it is not sufficient. Also, other arguments need to be presented. For return on investment studies, it is necessary that countries or relevant initiatives really demonstrate robustly and systematically the utility of prioritizing investment in One Health over other investments. When looking at what is available in terms of evidence, we see that various studies have demonstrated the added value of One Health initiatives in different fields already, spanning a range of One Health topics such as infectious diseases, AMR, food safety, and ecosystem health. But there are still major gaps when it comes to more complex One Health analyses that are looking explicitly at the value of working in a One Health way in socio-ecological systems, or if we are looking at wicked problems in these complex systems. Despite these challenges, the international community is making progress in the methods for economic evaluation of One Health initiative and is generating more evidence on the value of One Health. Several efforts are also underway to make this happen in a more standardized way and linking it to country investment leverage. Despite this progress, it will be good to have more hands on board, and we invite people to join these efforts. My final point is that with One Health thinking and the sustainability agenda, we also need to think about an economic paradigm shift. So far, in the other points, I have talked about the value of One Health and resourcing in existing economic models and within conventional development narratives. However, in our report, we also look at critical questions about paradigm shifts. As many studies show, we are already operating beyond the planet's natural capacity. There are also studies that show that in many wealthy countries, the marginal benefits of increasing, for example, gross domestic product further are diminishing or are reaching a point at which the benefits of further growth are outweighed by the costs. Therefore, we believe it is important to have dialogue on how we can move towards economic systems that are less resource extracting and ecologically destructive and promote equity and well-being. In our report, we refer to blueprints that advocate for alternatives to growth and that support such a shift, including donut economics, circular economy, the well-being economy, and the degrowth agenda. We encourage the One Health community to engage in dialogues on these alternative paradigms. Hopefully, these 4 points have given you a bit of a taster and encourage you to have a look at these sections in the report. Thank you.
Thank you ever so much, Barbara, for that really comprehensive and pointed response to the question on how we can promote sustainable One Health financing through demonstrable returns on investment. And Ramanan, I would love to hear your response to the points Barbara has raised and any others you might have.
Thanks, and congratulations, Andrea and John. Great work pulling this commission together. I know it couldn't have been easy because One Health is such a broad topic. I figured that given the topic of One Health, we should bring at least one animal to the discussion, and this is Quack, who we rescued from the street just last week. So he's happy to be part of the discussion as the one non-human participant in the Lancet launch. Quack's just like a month old, so he won't do very much. So in response to Barbara's points, and I think also we have to keep in mind that there's One Health, the concept and paradigm, and there's One Health that we might try to operationalize in some sort of very real way of organization. And those are slightly different things. So if we start from where things are today, yes, funding is very siloed, and that is for a reason, which is that this is how public health is operated. So the money is there for vaccines or child survival or reducing maternal mortality, because there is a very clear endpoint which can be tied to that funding. And that facilitates working within that kind of a linear framework rather than something which is much more complex like One Health, where tying endpoints and outcomes to interventions is definitely more difficult. It doesn't mean that it's impossible. It just means that it's more difficult, and certainly governments that are subject to a lot of scrutiny for not wasting resources would be uncomfortable with supporting something where they can't see a clear endpoint to where they need to be. Now, that doesn't mean that this is not cost effective. It just means that it's going to be a way in which we have to start from where we are right now. If we take AMR, for instance, we haven't even managed to get funding for something as simple as, say, animal vaccines, which could have a tremendous effect on human health by reducing the consumption of antibiotics. We haven't managed to get any kind of support or funding for alternatives to the use of fungicides in agriculture, which again would protect those antifungals for use in human medicine. So even within specific domains where the problems are well identified, it has been hard to find ways to tie very clear interventions to outcomes. In fact, to the point where even tying human vaccines to AMR has been a challenge, as David Heyman will tell you, even though this seems like the most obvious thing to do. So I think that we have to proceed in stages and not be frustrated. This is going to take a long time, but this is going to be a challenge. And I think that I just mean that the siloed funding is not necessarily the problem. It is siloed funding without taking into account the unintended consequences or the knock-on consequences. That's really the problem. And as long as those are recognized, we can broaden from where we are to where we could be. Using innovative financing mechanisms is definitely very useful. Now here, I would tie to one of your main messages, which is also of using private sector involvement. And here, as you will see with some of the other points, it comes to the value proposition as well. The challenge is there's a private value to investments in One Health, and there's a societal value. And the question is, who bridges that gap? It's the same for antibiotics. So there's a private value of antibiotics, there's a societal value. And the question is, who bridges that gap? And here we've got to have to figure out exactly, how we're able to bring financing, to be able to take into account some of these externalities, which is really consequences from our doing things that then affect other sectors. I think just simply adopting One Health as language is not sufficient. And I also want to come back to a point that Ilona made, which is about the significant resistance that One Health as a concept still has amongst many LMICs, particularly that are involved in agriculture in a big way, particularly livestock production. We saw this during the UNGA high-level meeting on AMR, which is that people see this as a code word for trade restrictions, which could then hinder their ability to export. So yes, we mean everything in a well-meaning way, but we have to keep in mind that the trade world operates in a slightly different way, and anything which is a competitive advantage will be used. And countries are concerned that that something like One Health will be used as a competitive advantage by one entity, one country against another. And therefore, when we do innovative financing, we have to recognize that it will have to make sure that whoever the losers are in this. To give an example again from the antibiotic space, countries that perhaps use a lot of antibiotics today in their poultry are compensated in some way to give up that practice while transitioning to a pathway where they don't do that anymore. Simply just changing these rules in the pursuit of One Health, while might seem the scientifically right thing to do, might not be politically wise, and to be perfectly frank, it may just not be possible, given that you won't be able to get the consensus to make it happen. The third point is really around One Health value proposition. Now, this is actually, again, quite challenging. So having a demonstrable return on investment is definitely necessary. And here there is a whole world of things which relate to the environmental world, which deal with things like ecosystem services. The fact that things that we do in the environment actually come back to human health, anyway. And here we have to recognize that in all of these value propositions, we might be concerned about animals, we might be concerned about plants, but at the end of the day, the value proposition is always framed in the context of the perspective of humans. So it is that, does it save lives? Does it reduce, healthcare costs? Does it improve productivity? Does it reduce poverty? So it's always going to be framed in this sort of a way. And we have not done enough work to tie many interventions in other domains back to humans. Now, this is not a question of judgment of whether I think this is the right thing to do or not. I'm just saying this is the practicality of the world. So for instance, some work done a couple of years ago on showing that vaccinating chickens in, I think it was Kenya, would increase school going in children in those households when you vaccinated against Newcastle disease. Now that made a very strong value proposition that intervening on the animal health side was helpful to reducing poverty. I'm in India right now. India has more cattle than China, EU, and the US put together. So you don't have to make a case to most people who own cattle here that this is the most important thing. It's really their entire wealth is embodied in that animal. So One Health doesn't have to be explained to people who are engaged in marginal or sustenance livelihoods. That value proposition is absolutely clear to them. The value proposition, oddly enough, has to be made to people like at the World Bank or the funders who are sitting in glass and steel offices, whether in Washington D.C. or London or wherever, to say that this is actually what would reduce people, get them out of poverty and improve their livelihoods. One of the words that I wish had been used a little more in the One Health Commission is really the word poverty, because the reason is a lot of financing is available for poverty. It is a stated goal of many countries for their political purposes to reduce poverty. And if we can tie a One Health investment as the value proposition being reducing poverty, equity is important, but I think reducing poverty is the best way to improve equity. We don't have to equity has multiple connotations. I'm all for reducing equity, but I think I'm first and foremost for reducing poverty. So I think we should be very sharply focused wherever possible, because if we're not sharply focused, then we won't get to the results that we want. The last point is about economic paradigm shift, extremely important and for many, many reasons. Now here again, there's been an entire parallel movement on something called green GDP, which is to incorporate into GDP measurements, and this has been for decades, things that don't go into GDP. For instance, uncompensated work at home by, women and girls, or, environmental impacts in terms of, environmental destruction, which should, technically reduce GDP, but it does not. So I think that, as the public health world, we have not engaged in that broader GDP conversation, but we should. The environmental world has engaged in it, but I'm glad, John and Andrea, that you guys have brought this up here, because if we consistently engage in that as a means, I think, yes, this loss of funding is all very unfortunate, obviously, for the last, what's happened in the last 6 months, but maybe it will sort of focus us on putting our attentions onto things which fundamentally change what gets measured. And if we change what gets measured, then maybe what we want gets done. Thank you.
Well, thank you very much for that, Ramanan. Really, really comprehensive. And because of a time constraint, I will go on to the next set of questions. And I can see many of you still online. We have well over 300 still online. So thank you very much. The last question, and I'm posing this to Renzo Guinto, is an associate professor at the Duke NUS in Singapore, and is a leading planetary health advocate in the entire Southeast Asian region, trained in Harvard in public health, and is an award-winning thought leader, advising at a very high level global and regional bodies on climate and health. And Chris Walzer, who is executive director of health at the Wildlife Conservation Society, globally recognized wildlife veterinarian and conservation scientist. He put forward the Manhattan Principles and the Berlin Principles as well, and has really worked on this for the longest time. And to the both of you, starting with you, Renzo, how do we ensure equity in One Health knowledge systems, in education and in training? And when you're done, I'll have Chris respond to this as well. Renzo.
Good evening from Singapore, from Southeast Asia. It's very late here, but it's an honor and privilege to be part of this commission and to have worked with amazing colleagues from around the world. One Health Knowledge is the last section of our report before the recommendations, which I think is a fitting culmination because this report in itself is knowledge, a synthesis of the current state of One Health knowledge and a roadmap for the future knowledge that we will have to co-create and share to improve the world. This report also reminds us that we must be perpetual learners of One Health, never stopping to learn, constantly open to diverse ideas and perspectives, committed to translating knowledge into real impact on people and the planet and all its other inhabitants. I think One Health is not just about knowledge about life, but it is living knowledge. And so if you will read this section of the report, you will notice that we use the word knowledge because it's not only about education and the role of the university. Our report navigates various what I call dualities of One Health knowledge. One Health is global, both global and local in source, in reach, in relevance, and in impact. Knowledge from academia and from the university, but also knowledge possessed by local communities and indigenous knowledge systems, which has already been alluded to repeatedly over the past 2 hours. Knowledge also between the young generations and those who are young at heart. And so, if you are a young One Health learner in this Zoom, please give a thumbs up because we want to see the future leaders of One Health. And also One Health knowledge is not only about the technical, but also leadership, community building, outreach, driving transformational change. So those are some of the highlights of the One Health knowledge section in the report. I'm sure you all know the adage, knowledge is power. Knowledge is vital. And that's why it's not an accident that 3 out of the 10 recommendations, which were presented a while ago, are about One Health knowledge. One is mainstreaming One Health throughout the higher education sector, not only in the classroom, but also through experiential learning, to cultivate enabling conditions for One Health research and knowledge production, and to achieve a One Health literate global citizenry. Again, citizens, not just professionals, because One Health literacy, according to our commission, must happen throughout the life course, from teaching One Health to children all the way to making media and journalism as allies in One Health communication to the broader public. So now let's add equity to these recommendations, because that's the main question. Equity may be a central tenet of One Health, as mentioned in a report. But equity, unfortunately, but unsurprisingly, does not happen automatically. We must be intentional. We must be proactive. We must tackle not the cosmetic, but the systemic. It is true for making One Health knowledge systems equitable, but it also applies to other avenues for One Health operationalization. So how can we make One Health knowledge more equitable? We need to establish more One Health centers, programs, networks. Our report cites the likes of Siohun and Afrohun. We need more of them. We need to sustain these networks. A landscape paper that I co-wrote a few years ago revealed limited One Health programs, both in number, but also they're concentrated still in the global north. But there are promising examples from places like Rwanda, from here in Southeast Asia. More needs to be established, not only to strengthen One Health capacity in low and middle income countries, but also for high income countries to learn from LMICs, because One Health learning is bidirectional, even multidirectional. And to colleagues and friends from the global south who are here in Zoom, or those who are from outside of Europe and North America, let's do One Health in a way that integrates global and local science, knowledge, culture, innovation. Yes, we do have shared principles, many of which are embedded in this report, but there is also space for many One Health solutions and innovations to bloom in different contexts and geographies. We must also call for sustainable and equitable funding for One Health research, especially with these funding cuts, the funding landscape that we have. But we also need to find or to remind funders to go beyond talking and giving promises about funding One Health or climate and health or transdisciplinary and cross-sectoral work. We must demand our national governments to invest in One Health knowledge systems, institutes, learning communities. We must leverage digital technology to ensure the rapid dissemination of and universal access to One Health knowledge and solutions. but we must also make sure that technology, whether it's the internet or AI, does not exacerbate existing digital, social, and health divides. We, One Health community, must synergize with other related, in fact, connected communities like Planetary Health, to which I also belong, EcoHealth, GeoHealth, because we all have a shared goal of healthy people, healthy planet, healthy creatures great and small, air, land, and water. And we must lead in the defense of knowledge and science in this time of dis and misinformation and distrust towards science and institutions. If science is under threat, One Health is in jeopardy, and our collective health is not safe. And finally, to the young One Health learners in the class Zoom, I always remind my students that by the time you graduate from school, you must have at least 5 new friends who come from other disciplines. That's One Health. You must also read papers and books from other cultures, places, knowledge systems, and not only from the usual suspects. Learn One Health not only from the classroom, the conference, reports, and webinars like this, but from the communities in the real world, from people in the front lines. These are some practical tips that hopefully will help you make or become an effective and equitable One Health professional and leader. In closing, my fervent hope is that we will all work together with solidarity and humility to unlock the power of One Health knowledge of all forms, to drive transformative, systemic change for the achievement of equitable and sustainable health for all constituents of the socio-ecological system. I hope that the knowledge in the Lancet One Health Commission's report will be our steady and constant guide towards health for all. Thank you very much.
Thank you so much, Renzo, for that really eloquent response to the question on how we can ensure equity in One Health knowledge systems, education, and training. And if you had read the chat, you'd realize I had posted that I anticipate we shall be going up to 30 minutes over time. It's largely a result of the high level of excitement that we have in the room. So do indulge us. I still see a very, very good number still with us. So we apologize for this. It's for very good reason. The recording will also be available, I believe. So I'll hand over to you, Chris, to respond to Renzo's submissions, please.
Yeah, thanks very much, John. Thanks, Renzo, for your comments, and my heartfelt congratulations to John, Andrea, and the commissioners on this fantastic and really timely report, and many thanks for having me join today. Renzo's really outlined the issue very well and framed it as it is in the report, but I want to just give it more of a personal spin, maybe. Wanda previously emphasized that how do we get action and implementation? How do we get there? And I want to channel a dear colleague who recently pointed out to me as I was sort of moping around about the state of the world, education and knowledge is revolutionary action, or if that's too hard for you, then education is transformational action. And I think this is the core. And this report really is pivotal in providing the basis and some of the tools that we need for education, knowledge production, and knowledge sharing in order to advance equitable, sustainable, and healthy socio-ecological systems. And the very clear call, and this is what I like so much on the report, and I've said it before, is this call for systemic transformation and how the knowledge is generated, valued, and applied. And Renzo's already pointed this out, but moving beyond the traditional academics silos towards more inclusive, transdisciplinary. How many people use the word transdisciplinary all the time? I've never actually looked at what it means. Transdisciplinary approaches and participatory approaches. And that same thing, by the way, participatory approaches does require some knowledge on social scientists who actually know how to do that, and not veterinarians like myself who think we know how to do it and absolutely have no clue. So it's us to be open. And I like the way Enzo strengthens and builds on the strength of his young students and is pushing everyone on the call here to embrace that and move forward. But I also want to make a real clear call to those of us who are in academia or in positions, and we've been there for decades, we're established. Relax and start being a mentor. This is really, really important. And the report gives us the tools to be better mentors in this One Health space. I do want to highlight one or two small things still. One of them is that the report advocates for embedding One Health principles across higher education landscape and development of some core competencies. We've talked about the CABI. There's a new book. It's been shared in the chat. I saw that really sort of points out what we need. We need to move beyond our fixation with ECTS points, depending where you are in the world, but we need to be able to change curriculums. Time has come to change curriculums to include them. And that, I'm a veterinarian by training, and that means we need to move beyond outdated veterinary approaches to One Health, which is sometimes focused on farm to fork, and that's supposedly One Health. We need to get rid of that in the curriculum. And similarly, in the public health curriculums, we need to expand the traditional views of the continuum of care. We need to expand that to include all the things that you've outlined in the in this report. Most importantly, and this comes up repeatedly, that there's no single epistemology that will capture the complexity. Integrating scientific, indigenous, local, experiential knowledge is key. And I also want to, I think Ilona touched on it earlier, I also want to think artificial intelligence, for all its rubbish it's doing, is a huge opportunity moving forwards. But as Renzo pointed out, we need to be very clear that it does not reinforce the existing biases and problems. But let's not be so scared of AI hallucinations. Let's use AI hallucinations to get new insights, right? You can use mushrooms, you can use AI. These are really interesting approaches too. We need to look at the world in a different way. And I think this is what this report provides us. We need different ways to move forward. And I really compliment the commissioners, the co-chairs on doing that forwards. And thanks very much for your efforts of getting this out there. And we look forward to implementing it across our institutions in academia and beyond. Thank you very much.
Thank you very much for that wonderful discussion. And thanks to all of you who are still staying with us, even though we are over time. I come to you, Pam, so that you can discuss with or engage with our audience and their questions to the panel.
Thank you, John, and thank you to all the speakers in the last session. As you know, we are running over time, and we've just receiving so many great questions on the chat. So thank you for being so engaged. I know we've been sitting here now for over 2.5 hours. So I'm going to unfortunately not be able to do as many questions as I'd like, but just try and bring the webinar to an end in a way. So just one question to all of you, perhaps on the panel, those of you who wish to respond. If you could recommend just one institutional or policy change that would have the biggest impact on One Health implementation, what would it be and why?
I can go, Pam, if you like.
Oh, thank you, Ramanan.
Okay. I think that I would prefer to see One Health as much more as a paradigm and a methodology. And I would probably ask for the lead UN agencies that are working on whether it's food or AMR or climate, for all of them to reimagine their work, which has a One Health paradigm, and invite them to see how they might change the way in which they are working, how they would fund their work compared to what they're doing right now.
Great response.
To build on that.
Yes, I hope there's some UN people on the call. Yeah.
Yeah, no, to build on that, I think there's a need to, beyond the definition of One Health approach, there's definition to define what is One Health interventions. Because at the end of the day, what we are doing on the ground, it's concrete activity interventions. So looking at that, providing a definition, the characteristic will help those existing organizations to even better collaborate or coordinate their support to countries, or the work between ministries might be more easier. So again, my recommendation here is to agree on what is the One Health interventions and what are the characteristics of a One Health interventions. Thank you.
Thank you, Serge. Anyone else from the panel?
Can give it a go as well from my side, Pamela.
Thanks, James.
I mean, perhaps let me be provocative. Now is also perhaps a time to stop, regroup, and do it. We have now, and this report, of course, is also an important piece of that. We have now a large amount of reports and documents telling us how to do it. Some of them with the sufficient authoritative nature to be implemented. We have an article on a pandemic treaty. In Europe, we have now recommendations to the European Commission on how to do it. Now, I think not to lose the momentum. It's really time to look for these low-hanging fruits and find practical examples of implementing these many tools, reports, recommendations, guidelines, high-level advice. So I think it's time really to look into the policies where we can make. Let's also not be so big that we spend years trying to the perfect solution, but in specific areas or domains, perhaps outside the traditional emerging infectious diseases would be a win, or the AMR. Really find for the policies where we can do the so-called transformation approach, integrate the environment, and put on the table some hard evidence that it works. Time to convince people and funders is of paramount urgency. I'll go with that.
Thank you, Carlos. We have Renzo and Ole.
Yep. So from the education perspective, and I understand we have lots of academic leaders, educators, and young learners in this convening. You know, my recommendation, let's begin with the university. I mentioned a while ago, it's not just about the university, but we know that universities do play a critical role in leading this One Health transformation. Internally, let's build One Health. You know, you can call it the task force, committee, inter-faculty initiatives, and then outside of the university, we need to build connections with local government, with civil society, with frontline communities. Let's bring One Health to life at the level of the community. Thanks.
Thank you, Renzo. Ole.
Yes, I've had the pleasure of working over the past few years in a rather tight relationship with policymakers, particularly at the EU level. And I'm reminded time and time again that one of the things that we have to focus on in order to, make progress and walk the talk is simply to be able to document, even in a more persuasive manner, the cost of inaction, the cost of not having a One Health approach. And, I have to be a bit humble when I've been exposed to policymakers, and I say that now is the time that you work together, you bridge the silos, and you coordinate your endeavors or your policies in a One Health perspective. I mean, the recurrent question is, what's the win? What is the added value of doing this? And of course, there's a lot of scientists, including those who attend this meeting, that have contributed to this demonstration of the cost of inaction. But I think we have to improve on this. Because, I've been in academia for quite a number of years. And when I feel that I'm not really able to convince policymakers that they have to stop having these siloed governance systems, then something is wrong. So I have to say, we have to improve, Renzo, in the universities to be able to provide the evidence that is required to be sufficiently persuasive, that One Health has to permeate the governance system in the years to come. So it's a bit, have to be a bit self-critical. We haven't really succeeded in demonstrating sufficiently the cost of inaction. Thank you.
Thank you, Ollie. I think we have Barbara next.
Yeah, thank you very much. It's great to see that nowadays we have so many different resources available. On One Health, there are several One Health books out there. There are One Health courses at undergraduate, postgraduate level, professional level, and some of these courses are free. We also have many reports and a lot of scientific papers that are really showing how One Health has evolved and what it does, what a One Health intervention is, what One Health surveillance is, etc., and all of these things. But what I also see quite a lot is that people don't have the time to engage with all these great resources that are out there, and that this is very much a limiting factor. And so I would like to encourage people to do that, to find ways to engage with the resources that are out there, including, of course, our report. And also then think about how in your own institution, in your own context, what can you do to dismantle these barriers? What is it that is the one thing that you can maybe influence to help bring One Health really into these different systems? Or let's just say we need to permeate the governance system, but I think we need to permeate many other systems. And I think that can be done if people have the right knowledge and find ways of acting in their contexts. Thank you.
Thank you, Barbara. I think, Chris, did you want to have the last word?
I'll be very short, and it's actually something positive, I think. So
Great.
That's nice.
Good.
It's been a bit of a
we
bummer.
want to end on that.
Yeah. So I think one thing, I've been on many of these panels, and we always flog ourselves like we need to do more. We can't convince people about the importance of them. But on the flip side, and building a little bit on what Barbara said, a lot has been done. A lot is available, and a lot of implementation is actually happening. The people who are doing implementation simply don't have time to write little books and papers and publish it and so on. So we need to also build and strengthen the things that are already happening. We need to be aware of all the great work that's going on in the One Health or a systems-based approach to health, and build on it. Can we do better? Absolutely, we can do a lot better. But let's not forget, we've done some really good one, and we've got to come a long, long way in the last decades. So thanks for that.
Thank you, Chris, and thank you for ending on a positive note, but lots of food for thought and a great discussion. I hope those of you still online, I congratulate you, those of you who are still online, to stick around for as long as you have, but I hope, like me, you found it a very inspiring and a very informative couple of hours. I'd like to thank each of our commissioners, all our external experts, our moderators, including the support of John and his team in Ghana, and our global audience for engaging in today's launch. You've been fantastic. I've been keeping an eye on the chat and all the questions, and I hope post this event we'll be going through some of those questions and comments and think very carefully, and hopefully that will inform some of our next steps post publication of this report. So on that basis, I'm now going to sort of hand over to John and Andrea for some closing remarks. To you, John and Andrea.
Thank you very much, Pam, for these lively discussions that you oversaw. And of course, we could go on forever, but we have to close. And again, thanks a lot for all your patience. I've got the difficult task, but also the honor to summarize quickly what are the most important take-home messages, or let's say buzzwords, keywords, and then John will give a quick outlook to the future. I've actually here my own notes that I will, just in the interest of time, use, but feel free also to display the slides that I haven't seen yet that were compiled in the background, and I'm sure together we can arrive at a rather complementary take-home messages. So the first pair, David and Wanda, you made clear that, of course, infectious diseases and emerging infectious diseases lend themselves very well to a One Health approach. Wanda, you said, however, we needed a shift from reactive to a preventive mindset for disease surveillance. And in fact, we needed to look at interfaces of spillover, and those interfaces needed to be contextualized, and that we have to go into, from theory, we have to get to action. Ilan and Chadya, I beg your pardon. It's about systems thinking. Ilan very nicely, through storytelling in a way, made clear how complex our systems of interdependency are. And that actually we need measures, we need metrics. A lot is qualitative, but we also need quantitative parametric measures. And Wanda reacted to it by pointing out that there are conceptual, structural, and political hurdles that still need to be overcome. I moved to Alafia and Ilona. Alafia made clear that NCDs really need a place at the table. Buzzwords like environmental risk factors, urban planning, also trade regulations were explicated by Alafia. And you also, Alafia, you called out to engage with corporate decision makers early on in the process, and have them as partner, but also call them out on all the negative impact that they cause. And Ilona, very rightly you mentioned socio-ecological thinking has actually been around for a long time. Why hasn't it been picked up better? Why is there no buy-in from decision makers? And you yourself have been doing a lot of work on this. You called for alliances between health promotion, planetary, and One Health. You also mentioned interrelated determinants of health, or better, of One Health. And you were calling out also on the commercial determinants of health. You mentioned our technopolar world, and you mentioned as well boundaries and tipping points that should not just be applied within planetary health, but also to NCDs and health at large. I move to the second panel. Carlos, Serge, and Olipeta. Food sustainability needs a One Health approach, but we need transformative approaches. One Health aspects can help govern global health in bleak times, because in fact it's about integration. So we need less resources if we do it better. Olipeta, you mentioned the sticky institutions and what can we do to make them change. And you said that two elements should have been brought out more in the Commission, and we can be very persuasive with those two elements, namely research and shared joint data, integration of data, One Health data throughout. Barbara and Serge, we have to secure One Health financing, and there are innovative financing mechanisms that we can use, but they also need to be implemented properly. Several funding streams need to come together to form one really strong stream. The World Bank has been instrumental. You called out the pandemic fund, Barbara, very important, and a small discussion emerged around return of investment. Serge, Ramanan, I made a mistake here. It was, of course, not Serge, it was Ramanan. One Health thinking needs economic paradigm shifts. You also, again, explicated the involvement of the private sector. Poverty should be mentioned more in the One Health discourse, and we need a broader GDP conversation. I want to quote you, Ramanan. If we change what we measure, maybe we can get done what we want. I love that. Last but not least, Renzo and Chris, very powerful. Renzo, you just summarized our 3 recommendations on knowledge production and integration throughout the life course of the Commission. And Chris, you reacted to it, saying that One Health is actually multi-directional, that communities and the young generation needs to be on board, that equity is key, and that education needs to lead to transformation and maybe also revolution. We need to change the curricula. We need to expand the curricula. We need to integrate indigenous knowledge. AI is a great opportunity, but the caveat stands, we should not create new silos. And herewith, I pass on to John for an outlook and the closing remarks. Thank you very much.
No, thank you very much. I think we would put a cap on it here. We just have 3 minutes to go in the extra time we imposed on you. And I'll just conclude and touch on just maybe I'll just touch on the number 5, which is really the One Health geopolitics. And in many of our submissions today, we heard how the world has changed significantly, and One Health really has a role to play. I think particularly One Health education is so critical, and we could see from the discussions, because clearly people have different ways of thinking, but the fact that we share the world, we are inextricably interconnected, will never change. And if we understand this fact and how this inextricable interconnection really works, and how our actions, reactions, inactions impact on this, and we can share a certain ethos, hopefully we can turn some things around and have a better world to share, a world where we'll have healthy, sustainable, socio-ecological systems. And with that, I'd like to say a big thank you to all of you for staying with us. We're very happy to share with you that we had close to 1,000, actually over 1,000 people registering from all over the world. The colors you see there are showing where the registrants come from. But at the highest point, we had about 500 on the call at the same time. And we're 30 minutes over, and we have just about half of that on the call. With that, from myself and from Andrea, and I believe also from the Lancet, Pam and Richard, I want to say a very big thank you to you. Sincerely, I appreciate it. And do engage with the Lancet One Health Commission on the website lancetonehealth.org, which will soon go live. Certainly access the report, enjoy, share, make the most of it, and watch this space. Bye-bye.